My name is Julio Chavez from the Moffitt Cancer Center. This is the update outcomes with axicabtagene ciloleucel retreatment in patients with relapsed refractory indolent non-Hodgkin lymphoma in the SUMA-5 study. Axicabtagene ciloleucel, or axicel, as we know, is an autologous anti-CD19 chimeric antigen receptor therapy that is currently approved for relapsed refractory diffuse large B-cell lymphoma and also refractory follicular lymphoma. The SUMA-5 is a multi-center phase 2 study that study axicel in patients with relapsed refractory indolent lymphoma that led to the approval of axicel in refractory follicular lymphoma. In this study, I will be presenting the updated analysis of the 13 patients who were retreated, meaning that those patients who had received axicel and then relapsed and were retreated with a second infusion of axicel. There were a total of 13 patients, 11 patients with follicular lymphoma, and 2 patients with marginal zone lymphoma. The median time between first infusion and retreatment was 10.6 months. At retreatment, the overall response rate was 100%, with 77% patients and CR. The median follow-up was almost 12 months, and the median duration of response was not reached. In terms of toxicities, the main toxicities such as cytokine release syndrome and neurotoxicity were not different from prior or from the first treatment. So the treatment was safe and toxicities were manageable. The data suggests that on patients who had a prior response to axicel with indolent lymphomas, retreatment was feasible and safe, and is considered a promising option of patients with relapsed refractory indolent lymphomas.